can. Yep.
So everybody ready? I'm countdown from 3, 1, 3, 2, 1, smile. Hello. 3, 2, 1, smile. So everybody ready? One more. Countdown from 3, 1, 3, 2, 1, smile. Hello. 3, 2, 1, smile. Everybody ready? Sorry. Countdown from 3, 1, 3, 2, 1, smile. Hello. 3,
I'm
2,
sorry.
1, smile.
I'm so nervous.
Sorry. Countdown from 3, 1, 3, 2, 1, smile. Hello. 3,
I'm
2,
sorry.
1, smile.
I'm so nervous.
Sorry. Countdown from 3, 1, 3, 2, 1, smile. Hello.
Why is there?
3,
Sorry.
2, 1, smile.
I'm so nervous.
Sorry. Countdown from 3, 1, 3, 2, 1, smile.
The
Hello.
photo looks
Why
great.
have someone joined in?
1, smile.
I'm nervous.
Sorry. Countdown from 3, 1, 3, 2, 1, smile.
The
Hello.
photo looks
Why
great.
have someone joined in?
1,
Yes.
smile.
Do you want to turn off the mute your microphone?
3, 2, 1, smile.
The
Hello.
photo looks
Why
great.
have someone joined in?
1,
Yes.
smile.
Do you want
Were you all getting replay? Was there a replay occurring?
reply for what?
No, when Mei Ling was taking the photo, was there repetition of noise? No? No, that's okay. All good.
So if in this case, I will make a noise so I don't take the photo during the webinar.
No, that's fine. All right, I'll share the screen again. Get ready. Hmm.
Cause you're a sky full of stars. I'm gonna give you my heart. Cause you're a sky full of stars. Cause you light up the path. I don't care, go on and tell
Can everyone just see the webinar agenda and poster on their screen?
Yes, perfectly.
Okay, good. Just double checking.
I think I saw you. I don't care, go on and tear me apart. I don't care if you do. Cause in the sky full of stars, I think I saw you. I don't care, go on and tear me apart. I don't care if you do. Oh, 'cause in the sky full of stars, I think I saw you.
짱이가 좋아하는 랜덤 게임 랜덤 게임 게임 스타트 아파트 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 kissy face sent to your phone but I'm trying to kiss your lips for real red hearts that's what I'm on yeah come give me something I can feel don't you want me like I want you baby don't you need me like I need you now say tomorrow but tonight go crazy all you gotta do is just meet me at the 아파트 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 아파트
First things first, I'ma say all the words inside my head. I'm fired up and tired of the way that things have been. Oh, ooh, the way that things have been. Oh, ooh. Second thing, second, don't you tell me what you think that I can be. I'm the one at the sail, I'm the master of my sea. Oh, ooh, the master of my sea. Oh, ooh. I was broken from a young age, taking my soak into the masses, writing my poems for the few that look at me, took to me, shook at me, feeling me, singing from heartache, from the pain, taking my message from the veins, speaking my lesson from the brain, seeing the beauty through the. Hey, you make me a believer, believer. Hey, break me down, you make me a believer, believer. Hey, let the bullets fly, or let them rain. My life, my love, my drive, it came from. Hey, you make me a believer, believer. Third things third, send a prayer to the ones up above. All the hate that you've heard has turned your spirit to a dove. Oh, ooh, your spirit up above. Oh, ooh. I was choking in the crowd, building my rain up in the cloud, falling like ashes to the ground, hoping my feelings they would drown, but they never did. Ever lived, ebbing and flowing, inhibited, limited, till it broke up when it rained down. It rained down like. Hey, you make me a believer, believer. Hey, break me down, you make me a believer, believer. Hey, let the bullets fly, or let them rain. My life, my love, my drive, it came from. Hey, you make me a believer, believer. Last things last, by the grace of the fire and the flames. You're the face of the future, the blood in my veins. Oh, ooh, the blood in my veins. Oh, ooh. But they never did, ever lived, ebbing and flowing, inhibited, limited, till it broke up when it rained down. It rained down like. Hey, you make me a believer, believer. Hey, break me down, you make me a believer, believer. Hey, let the bullets fly, or let them rain. My life, my love, my drive, it came from. Hey, you make me a believer, believer. I'm better, so much better now. I see the light, touch the light, we're together now. I'm better, so much better. Life, we're together now. We've only just begun, hypnotized by drums until forever comes. You'll find us chasing the sun. They said this day wouldn't come, and we refuse to run. We've only just begun. You'll find us chasing the sun. You'll find us chasing the sun. You'll find us chasing the daylight's fading. We're gonna play in the dark till it's golden again. And now it feels so amazing. Can see it coming and we'll never grow old again. You'll find us chasing the sun. I'm never down. Lying here staring up and you're looking down. I'm never down. Live forever, forever with you around. We've only just begun, hypnotized by drums until forever comes. You'll find us chasing the sun. They said this day wouldn't come. We refuse to run. We've only
Hello.
Hi. I'm just gonna should I just check that my slides work?
Uh-huh.
I'll just
I'll just stop. Hi, how are you, Fiona? Sorry.
Hi Belinda, sorry. Yeah, sorry I jumped on a bit late. Can I check if my slides work or should I
Yeah, just I'll stop sharing now. You
Yep.
can just quickly check.
Okay, cool. You can request close. Okay, so let me share. Oh, I think I have to send, do I have to send request? I've just sent a request to you. I think it should work now. Yeah, okay.
Yeah.
Okay.
It's
You guys can see it. I'll just change over. Yeah, you can see it okay. I'll change over to presenter not presenter view. What do you call it? Slideshow view. Yeah, is that all right?
Yep.
Perfect.
Yep. Okay, cool.
Perfect.
All right. I'll stop it now then. Cool.
How are you going? All right? No, you've had a busy day.
I've actually had a very busy last few weeks. Yeah, we just did a big Doctors for the Environment Australia and College of Physicians meeting last night, which I single-handedly organized. So and then I had a presentation for it. So I've been putting a lot of effort into this. So I apologize if I'm a bit out of it, but yeah.
Thank you so much for accepting our invitation for this keynote speech.
Yeah, no worries. Sorry, God, I didn't think it was such. Can I just clarify with you because I should have actually clarified a bit earlier. So is this so it's mainly at nurses, but it sounds like it's quite international.
It
Yes.
is. Yes.
Ah, okay. Oh no, okay, because I've got a lot of Australian stuff in it, but okay.
Fine.
Is that okay?
Dr. Jane from South Korea, who's presenting from South Korea's perspective. So
Okay, all right, good.
I think this
I am a little
issue
bit-
is a global issue. It's not restricted to local area like Australia. I think every places needs this insights. So thank
Yeah,
you.
no, I agree. Yeah. So I've got a bit of global stuff, but yeah, just giving a few Australian bits. Yeah.
Hello, Dr. Fu. Hi, welcome to the webinar.
Hi, how are you?
Yeah, but Elle, shall we on time or we need to maybe wait a
It's 9 attendees, but we have 105 registrations.
Oh, wow.
So how about we just wait another 5 minutes? Is that okay?
Yeah, that's fine. Yeah.
Thank you.
It's starting to come. Can you still hear music or is that stopped now?
I can't hear music.
Beautiful, fantastic. Thank you.
Hello. Oh. Hello, I'm Yasuda. Hi, oh, nice to meet you. Okay. Can you hear my voice?
Yeah, clear.
It's okay?
clear.
Okay. So
Would you,
may
would you
I
check?
share
Yeah,
my
slide.
the slide for the
Mhm.
test?
Mm-hmm.
Okay. Can you see that?
Yes, the full
Yeah,
view.
yeah. Yeah. Is this all right?
Yes, perfect.
Okay. Okay. It's working. All right.
Thank you, Dr. Jane.
Okay.
Dr. Zhang, before your presentation, I will just introduce you briefly.
Okay. All right.
Okay, see you.
I'm really nervous because do we have a lot of the register for this webinar? How many people?
105.
Excuse me?
105.
Wow. Many people come from the different kind of site. Okay. All right. Okay. Okay. I need to wait for a while. May I off the video and audio for a while? Okay.
Yes,
So when we start, I'm gonna turn off the everything. Okay. See you later. Thank you.
Welcome, everyone. We might get started. Lynn, did you want to start the introductions?
Right. Good afternoon, everyone. I am Dr. Mei-Ling Ye. It's my pleasure to be one of GNLI panelists in today's webinars. I also serve as the moderators in this section. First of all, welcome to our webinar, Enhancing Health Safety for Vulnerable Populations in the Western Pacific region. This event is organized by the ICN GNLI 2023 scholars. Ms. Belinda Abbott, nurse lectures at the National Canberra and the Fellow of the Australia College of Nursing in Australia. Dr. Shariful Mohideen, a professor and a dean at the Faculty of Allied Health Science, City University, Malaysia. Dr. Senju Kwang, a professor at Yonsei University in South Korea. Dr. Yume Chen, associate professor at Kaohsiung Medical University in Taiwan, and myself, Dr. Mei-Ling Ye, distinguished professor at National Taipei University of Nursing and Science in Taiwan. We are grateful for your participation as we address enhancing health and safety for vulnerable population. Now I would like to hand over to Ms. Belinda to deliver the opening remarks. Please join me in welcoming Belinda.
Belinda, you're muted.
Belinda.
Always technical issues at the beginning. Welcome, everyone. We're very excited to have you all here with us today. First and foremost, I'd like to acknowledge the traditional owners on the lands that I am coming from, the Ngunnawal people from Canberra in Australia, and acknowledge our traditional owners and the lands in terms of the land, the sky, and the earth, and what they give back. So it's just a very special day today. I'd like to welcome our honorary presenters, Dr. Fiona Fu and Dr. Yuan Su Zhang, distinguished guests, and all in attendance today from our national nursing associations and nurses from the Western Pacific region and across the globe to our webinar forum on enhancing heat safety for vulnerable populations in the Western Pacific region. Since 2023, our team of 5 have focused on a topic that's close to our hearts, and we knew from our initial literature review that the increase in ambient temperatures were impacting on human health across the globe. We also knew that from formal policies and legislation protecting the health of vulnerable populations in extreme heat events were lacking. We had the privilege to go to the World Health Organization in Geneva, and we got to talk to one of the World Health Organization scientists and team leader of climate change and health. And from that conversation, we commenced our journey on how we could, as a team of 5 from 4 different countries, make an impact and difference to influence and contribute to policy around enhancing heat safety for our vulnerable populations in the Western Pacific region. The Western Pacific region is facing a significant challenge with the increasing frequency and severity of extreme heat-related events. Nurses as frontline caregivers work collaboratively with other healthcare professionals and play a pivotal role in safeguarding the well-being of vulnerable populations, including older adults, children, individuals with chronic illnesses, outdoor workers, and healthcare professionals with limited resources. As you can see from the slide, the global temperatures from 1850 to 2024 identify the impact of global emissions on our world today. The healthcare industry is responsible for 5 to 10% of those global emissions. If the healthcare sector was a country, it would be the 5th largest emitting country in the world. As frontline caregivers, nurses play a crucial role in addressing the healthcare needs of individuals affected by extreme heat events. Their responsibilities extend beyond traditional healthcare settings, encompassing community, outreach, education, and the implementation of preventative measures. In recognising the unique vulnerabilities of different groups, nurses and healthcare professionals serve as advocates for the development and implementation of comprehensive policies aimed at enhancing heat safety and climate change on human health overall. The choices we make now will impact on the future experiences and those of our children. Our project's vision is to empower healthcare professionals, especially nurses, to take a proactive role in mitigating the impact of extreme heat events. The development of standardised regulations and guidelines aims to ensure consistent and effective care. Additionally, the project focuses on raising awareness amongst healthcare professionals about specific health risks associated with extreme heat, enabling them to provide targeted support to our vulnerable populations. This webinar will serve as a platform to engage stakeholders, share research findings, and discuss strategies for improving heat safety measures. The insights gained from this webinar are instrumental in shaping our final project, which will be the development of a comprehensive policy statement. We will be presenting this at the International Council of Nurses Congress in Helsinki this year in June in the form of a poster. With this initiative, we aim to address immediate health risks and build resilient healthcare systems capable of withstanding future environmental challenges. By integrating health and environmental policies, we strive to create a safer and healthier future for all. We'd like to take this opportunity to formally thank ICN for funding our project, and also a big thank you to our supervisor, Catherine Schofield, for her support and guidance. It is now my pleasure to introduce our first esteemed speaker for today's webinar, Dr. Fiona Fu. Dr. Fu is a highly respected clinical and interventional cardiologist who has made significant contributions to both cardiology and environmental health. She has written and spoken extensively on crucial topics such as climate change and cardiovascular disease, heart disease in women, and sports cardiology. Beyond her clinical work, Dr. Fu is deeply committed to advocacy and sustainability in healthcare. She serves as a co-vice chair of the Doctors for the Environment Australia, New South Wales Committee, and co-chairs the Macquarie University Health Sustainability Committee at Macquarie University Hospital. Additionally, she has dedicated more than a decade to interventional cardiology aid work in Fiji, supporting communities in need. Today, Dr. Fu will be sharing her expertise on a particularly timely and critical topic: heat health and cardiovascular disease, protecting the vulnerable population as extreme heat events become more frequent and severe. Understanding their impact on cardiovascular health is essential, especially for those most at risk. Please join me in welcoming Dr. Fiona Fu.
Thank you. Thank you very much for that introduction. I'm just going to get my slides up and everyone can hear me okay?
Yes.
Yep. Okay. So thank you, Belinda, and everyone for inviting me to talk this afternoon. So, sorry. So this is a big overview, and I will be talking about quite a lot of things, and I apologize in advance if it's a bit of information overload. As Belinda said, I do quite a lot of stuff in the Pacific, and I just add some fun to today's entertainment. Just don't try this kind of play at home. So let's get into it. We want to be talking about heat and the effects of heat if it weren't for the fact that our world is heating up because of human-made climate change. 2024 was the hottest world on record, and just beating 2023, which broke the hottest world on record the year before. January this year was the warmest January on record as well. 2024 was a masterclass in climate destruction. We've had multiple extreme weather events, one after the other, and these are all being supercharged by human-made climate change. The 2024 report of the Lancet Countdown on Health and Climate Change said people all around the world are facing record-breaking threats to their well-being, health, and survival from the rapidly changing climate. And one key message was that heat-related deaths among those aged 65 years or older has increased by more than 167% from levels in the 1990s. Global exposure reached a record high average of more than 1,500 hours of high temperatures. And we know that heat not only causes deaths, but it also worsens physical and mental health. There are also multiple life-threatening extreme weather events, as well as infectious diseases, increasing exposure to air pollution. And unfortunately, we've had delays in our adaptation, making people ill-protected from the growing threats of climate change. So Belinda did show this. This is the moving version of it: rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels, add to increasing extreme heat, severe weather, air pollution, increasing allergens, water, food impacts, and environmental degradation. All of these affect health. And from a cardiovascular point of view, it's heat-related illness as well as air pollution that significantly increase cardiovascular disease. So climate change has multiple both direct as well as indirect health effects on health. It also causes problems with health systems and facilities. It's undermining the social determinants of good health. And the people who are most vulnerable are those who are women, children, ethnic minorities, poorer communities, migrants, displaced persons, older persons, and those with underlying health conditions. And unfortunately, many of our neighbours in the Western Pacific region are particularly vulnerable in this space, specifically the Pacific Islands. So the environment is a significant risk factor for cardiovascular disease. It is one of the 3 modifiable risk factors for cardiovascular disease, the other ones being metabolic and behavioral. And you can see this is older data, but air pollution and non-optimal temperature were within the top 10. 2021, air pollution was the 4th highest modifiable risk factor for cardiovascular death, and this was higher than smoking. And the reason, I know this is about heat, but we need to know that air pollution, climate change, and other types of pollutants, they all interact and they all increase cardiovascular disease. So global warming leading to more heat events with the increase by air pollution, in particularly those who are older, those who have low socioeconomic status, and those who have underlying health illnesses such as type 2 diabetes, increase cardiovascular disease. So it's mainly heat as well as air pollution, but there's also the mental effects of climate change as well as infectious diseases, increasing cardiovascular disease. So we've got physical and mental health of climate change, but then there's also disruption of healthcare delivery, impact on social determinants of health, all worsening cardiovascular health. The main ones I'll be talking about today will be the heat events, but I will be talking about wildfires and air pollution. And I want to put this slide in, and this is just to get you thinking about what we call compound extreme events, because we're not now just seeing one extreme event, we're actually seeing one after the other. And so there's multiple problems with this. So we can have synergistic effects. For example, you have extreme heat and you have air pollution, and that brings on wildfires. And that combination of the effects of heat as well as the effects of air pollution from wildfires has a synergistic effect, increasing cardiovascular morbidity and mortality. You have cascading effects. So one extreme weather event after another, for example, we've had extreme heat and then followed by severe thunderstorms, and these have cascading health effects. And then there's ripple effects. So the effects of these extreme weather events on all the health infrastructure and the delivery of healthcare. So if we look at how climate change increases cardiovascular disease, from a temperature point of view, both high and high temperature, so high extreme heat and extreme cold increase cardiovascular disease. So it's a J-shaped curve. With regards to air pollution, you've got a hyperbolic curve, so sharp increases at lower exposure levels and then reaching a plateau at higher levels. So let's talk about heat and health. So normal temperature in humans varies by person as well as the time of day. The average human temperature is around 36.1 to 37.8 degrees Celsius. And the core temperature is regulated by the hypothalamus. This is responsible for regulating heat generation as well as heat loss. A person in good health can easily tolerate a moderate increase or decrease in temperatures. And the response to heat depends on the individual and their ability to adapt. The perception of temperature is determined by various individual factors such as respiratory capacity, how much exercise you're doing or your physical activity, the type of material, the clothing you're wearing, as well as other environmental factors such as humidity, solar radiation, wind, and ventilation. The greater the humidity, the stronger the thermal sensation, as it reduces the body's capacity to cool adequately, and other risk factors can cause additive or exponential synergistic effects. On the circulation, in response to heat, you have your superficial vessels that dilate and redistribute blood flow towards the skin. The skin then produces sweat, cools our bodies, and then limiting the increase in core temperature. However, when you redistribute blood flow to the skin, you get less filling of your heart, which results, and the heart compensates for this by increasing its heart rate and heart contractility. There's also sympathetic nerve activation, and this causes a rise in cardiac oxygen demand. Sweat production can also lead to dehydration, decreased blood volume. This increases cardiovascular strain, also causes acute kidney injury if your fluid and sweat loss is not adequately replenished. And extreme heat can also exhaust this thermoregulatory capacity of our bodies, resulting in overheating, and that may proceed to heat stroke. So when we think about heat and health, there are both direct as well as indirect impacts on our health. So you've got heat-related illness. So these are the ones we think of, like heat cramps, heat stroke, dehydration, heat syncope. But what people don't know is that accelerated death from underlying illnesses such as cardiorespiratory illness, as well as mental health illness, and increased hospitalizations from diabetes, respiratory, stroke, and mental health conditions. Then you've got indirect health impacts, so impacts on health services, ambulance call-outs and response times, increased risk of accidents. So, people go and swim more and then increased risk of drowning, increased transmission of food and waterborne diseases and algal blooms. And there's potential disruption of infrastructure such as power outages. Heat waves are considered silent killers, have caused more deaths in Australia than any other natural disaster combined, similarly around the world. And all these projections are expected to increase. There's data, particularly in Australia, about the heat wave related deaths in our cities that are projected to increase over the coming years. Extreme heat kills. Unfortunately, it kills Michael Mosley, and I think most of you guys know who Michael Mosley is. And this is a picture of Death Valley, and it's called Death Valley for a reason. It gets very, very hot and people just die. You can't survive in this extreme heat. In the summer of 2022, there were more than 61,000 people in Europe who died from heat-related causes. China was on track to see 20,000 to 80,000 heatwave deaths a year in one report in The Lancet. And the WHO predicts more than 250,000 annual deaths between 2030 and 2050 because of heat exposure. And this will particularly be from cardiovascular mortality. And heat exposure of older people will also at least double, in all continents by 2050. And the reporting of heat deaths is actually grossly underestimated. And that's because, unlike other natural disasters, most people, they don't say they died of heat. They'll actually say they died of a heart attack or whatever, but the heart attack was caused by the heat. So this is a heat health fact sheet. This is available on a Doctors for the Environment website. So I've talked about, this is something you can give to patients, just the general public. So, why is extreme heat bad for the body? There's heat exhaustion, heat stress, and some of the symptoms with that. And then the worst is heat stroke. And if you, identify, these kind of symptoms in heat stroke, you need to get to an ambulance or get to the hospital immediately. And what makes extreme heat even more dangerous if you combine it with other environmental issues? So high humidity, high night temperatures, high temperatures early in the season, disruptions to essential services, smog, and bushfire air pollution. Who is most at risk? So this is what we're talking about. These are the vulnerable people. So people with underlying medical conditions. So anyone with cardiac or respiratory disease, mental health issues, dementia, the older people, those who are frail, younger children, as they can't regulate their body temperature as well, those who are unable to move around, those who are homeless or have limited choices in their housing, work, transport, or cooling, those who are unwell with a fever, vomiting, or diarrhea, those who are pregnant or breastfeeding, those who take medications that affect the way the body reacts to heat, people who are socially isolated, especially if they get unwell and no one actually knows that they're getting sick, and those who work or exercise outdoors. So even all these athletes, you think they're healthy, but also all the sporting events, these are people who can be at risk. And again, in another way, this is, you know, these are these vulnerable groups. These got the physiological factors, the older, the younger, those with underlying medical conditions or taking medications, and pregnant ladies. Then exposure factors, the outdoor and manual workers, those who live in suboptimal housing, those who are homeless or displaced and low socioeconomic living conditions, and those athletes and attendees of outdoor events. And again, not going into it, but there's multiple reasons why these individual health, socioeconomic, and environmental conditions all increase the risk for heat illness and mortality. So from a cardiovascular point of view, heat increases cardiovascular mortality and morbidity. As I mentioned before, it's a J-shaped curve. At extreme temperature percentiles, extreme heat increases your risk of cardiovascular mortality, or all-cause cardiovascular mortality, as well as ischemic heart disease, stroke, and heart failure. And as I mentioned, the vulnerable populations are the older, the younger, those in low socioeconomic status, but those who also live in rural areas, those with low air quality, and those who suffer occupational exposure or have an early get an early hot season. And the primary cause of death during a heat wave is actually from a cardiovascular event. And I've kind of touched a bit about this physiology, but you know, some of the reasons to explain why. So as I said, the human body responds to heat stress. It redistributes blood flow to the skin. So you get more heat transfer from the skin to the environment. You secrete sweat, which evaporates and removes body heat. But this redistributed blood flow to the skin means you're getting less cardiac filling. Your heart has to increase your heart has an increase to cardiac demand, so it increases its heart contractility and its rate, and this increases coronary artery oxygen demand. Particularly in those who have an underlying heart condition, this can lead to a mismatch between high cardiac oxygen demand and compromised cardiac oxygen delivery. And if you have a sustained mismatch, this leads to cardiac ischemia, infarction, and cardiovascular collapse. So this is some of the things I talked about, but heat causes volume depletion. You get sympathetic activation, leading to heart rate increases in contractility. And then what's also important to know that many of these patients are on cardiac medications, and these can block some of these compensatory mechanisms, for example, beta blockers, and the other effects of other medications can exaggerate the effects of heat. So we know diuretics, vasodilators, they can also cause volume depletion and blood pressure reduction. Rising temperatures also increase metabolic state and oxygen consumption. Then there's also issues with increased hemoconcentration, increased blood viscosity, increased coagulation. Again, that can also lead to thrombosis and myocardial ischemia. And then I'm not going to go into this because it's very complicated and I don't understand all of it either. However, one thing to know is that, yes, we know that heat can increase all these cardiovascular events, but people can also get heat-related illness, in particular heat stroke, and heat stroke also increases cardiovascular disease. So this is just some evidence to show heat exposure and heat waves increases the risk of myocardial infarction hospitalization, as well as mortality. And the largest systematic review and meta-analysis found that if you have a 1 degree increase in temperature above your reference, it's associated with an increase in cardiovascular disease mortality across all types, but particularly for stroke and coronary heart disease, and as well as an increase in cardiovascular disease morbidity from arrhythmias, cardiac arrests, and coronary heart disease. Heat waves in particular are associated with a significant, more than 11% increase in risk of mortality, and this heat wave risk increases with heat wave intensity. These are Australian studies, and all of these studies have again showed an increased risk of cardiovascular mortality, as well as hospital admissions, particularly for ischemic heart disease and myocardial infarction, with heat over several days or a specific extreme heat event. And again, those with pre-existing heart conditions are at an increased risk. This is an abstract that we presented at Cardiac Society a few years ago, but again, showing heat waves, extreme heat, increases cardiovascular disease, particularly for ischemic heart disease and myocardial infarction and arrhythmias. And all of these heat-related cardiovascular impact is going to increase due to the effects of global warming, population growth, and aging. And I'll also remind everyone, but definitely around the world and in Australia, cardiovascular disease is the leading cause of death everywhere. So we can't talk about heat and not talk about wildfires, because we know wildfires are increasing And when you've got extreme heat, you're going to get more wildfires as well. We're getting more severe, frequent wildfires throughout the world. And the wildfires are major sources of air pollution. They generate various gases, semi-volatile liquids, and multiple pollutants, particularly PM2.5. There are multiple health effects of wildfire smoke, which parallel the effects of ambient air pollution. And there's a lot of data. I haven't put this in this presentation about the effects of air pollution on cardiovascular disease. Individuals who are most vulnerable are those who are older, those with underlying cardiorespiratory illness, pregnant, and people from disadvantaged socioeconomic and demographic groups. Bushfires have multiple health effects, loss of life, injuries, exacerbate mental illness, and they have effects on our land. This is again, the WHO is sensitive to the effects of smoke, but also realizing that people who do spend a lot of time outdoors and firefighters, they are significantly at risk. In fact, I do work for Fire Rescue New South Wales. Sometimes I review some of the patients, and the reason is because the #1 cause of death in fire duty related in the firefighting in firefighters is actually from a cardiovascular event. There's long-term effects of bushfire smoke. You can see here a whole list, including heart disease, dementias, cancers, stroke, diabetes. There's all the toxic chemicals. And then the other thing to note is that there's not only just the effects of smoke on the people, like where the bushfire is. The bushfire smoke actually travels. And, there's data from like the Canada fires that people in the US were getting increased respiratory hospitalizations because of that bushfire smoke that traveled downwards. But then, they've also got the immediate effects of smoke as well. Sorry, I should have said that first, such as itchy eyes, runny noses, etc. So wildfire smoke has been shown to increase cardiovascular morbidity and mortality, again, particularly from ischemic heart disease, but also heart failure and arrhythmia. It increases acute coronary events, chest pain, ischemic heart disease, and high blood pressure. And what I want also everyone to realize is that when you combine high temperatures with other environmental issues, they interact and they're actually more synergistic and cause even more problems than each of them themselves. So if you combine high temperatures and high humidity, high temperatures and high levels of air pollution, or high temperatures and low green space, you result in an increased risk for cardiovascular disease-related mortality, and in most cases, morbidity as well. And that's been shown for air pollution, particularly all types of air pollution, and also for wildfires. So these effects get amplified when you have air pollution from wildfires as well as high temperatures, which is what we're seeing a lot of. And this is, again, data from Australia. So I'm not going to go through all of it, but essentially, bushfire smoke contributes a significant number of deaths. And everywhere around the world, I mean, people in Australia think that air pollution is not that bad, but actually we're still above at the annual WHO air quality guidelines. And actually everywhere, 90% of the world has average annual PM2.5 concentrations that are above the WHO guidelines. And when you have bushfires, it significantly increases the PM2.5 and significantly worsens air pollution. You may or may not remember the 2019-2020 summer bushfires, but it caused our air quality to be many times the hazardous levels set by the WHO. In Canberra, it was more than 22 times. In sub-Sydney suburbs, more than 10 times. And they estimated the bushfire pollution caused more than 400 excess deaths and more than 1,000 cardiovascular disease hospitalizations. And it increased cardiovascular and all-cause mortality. There was another study that showed that, many other Australian studies have showed increased smoke events with cardiovascular mortality, ischemic heart disease, respiratory presentations, and heart failure. And then another one showing that combination of having a higher mean temperature, greater PM2.5, and the presence of a bushfire within 200 kilometres doubled your risk of an acute coronary syndrome. And so I just put these in just to show that there are days, for example, in Australia, where our air quality is like third worst in the world, and that's from backburning or from a bushfire. So no one, rich or poor, can escape air pollution. It is a silent public health emergency. I'm going to talk about mental health, and I've taken this from one of my friends who's a psychiatrist who does a lot of work on mental health and heat. But what I want everyone to remember is that mental health harms increase with heat. So every single type of mental health issue increases with heat, including ED presentations, hospitalizations, and mortality and substance use. And why am I, as a cardiologist, talking about mental health? Mental health is one of the most significant risk factors for cardiovascular disease. So everything from PTSD to depression and anxiety all increase cardiovascular disease. You also, there's also issues with if you combine air pollution and poor mental health, again, that increases cardiovascular disease. There's also issues with climate anxiety. Again, these are all factors that increase cardiovascular disease. Takotsubo, a condition you may or may not know of. So it's a stress-induced cardiomyopathy. So people can get that after extreme weather events. This is one after someone who's had flooding, but someone who's, had to evacuate because of a fire. I've had people who develop depression after they've lost their house to floods. All these kind of things that has impacts on cardiovascular disease. So how do we manage these patients in the heat? So there is no, I'm not going to tell you all the answers, but, this is kind of my take of what we can do. We need to identify those at risk. So I've talked a lot about who's at risk, the elderly, the young, those of underlying chronic illness, low socioeconomic status, outdoor workers and athletes. I kind of say to GPs and, healthcare workers like nurses like yourself, you could consider doing a pre-summer season medical assessment and give them some relevant advice. So I think we always need to talk about behavior adjustments and hydration. We talk about individualizing their medical medications. We need to talk to them about symptoms of heat-related illnesses and how we can prevent them and what to do and when to get attention, reduce air pollution exposures during wildfires, and tell them about resources. So Department of Health online information, and then contacts for emergency services. And we need to advise these patients that they are vulnerable and how they can protect themselves. And there's a lot of talk about heat health action plans as well for these patients. So multiple health conditions create high risk of health effects from heat. I've kind of already touched on most of them. So it's all the diabetes, mental health disorders, dementia, substance misuse, but there's also neurological disorders such as Parkinson's, multiple cardiovascular diseases, respiratory illness, renal dysfunction, obesity, and other chronic illnesses such as scleroderma. And these are some strategies that we can think about to use for the general population. So identify the heat vulnerable patients, alert patients and their caregivers to potential risks. We need to tell these patients about the signs and symptoms of heat-related illness. We need to provide counseling about how to reduce their risks and when to seek medical attention, provide education around the medications that may increase their heat risk, and provide counseling about access to cooling and what they can use strategies to cool themselves, review emergency plans in the event of an outage, engage social work and other related services, and make sure they, the other thing is look after other people. Now, I won't go into all of the athletes and the outdoor workers, but these are other big groups, especially like the athletes, but also it's just the staff and the spectators. They don't think that, at a sporting event, you could actually be vulnerable to these heat-related illnesses. But it is an increasing problem, particularly in Australia. We're a big sporting country. People watch cricket games in like 40-degree heat and they're there for hours. And then you've got all the outdoor workers who, have no choice and they have to often have protective equipment. And they're also very vulnerable. But they need to have plans about how they can reduce their risk of heat. So just general principles that you can tell your patients: keep cool, stay hydrated, keep your home cool, seek out the cool, take care of others, and keep food safe. So general behavior and hydration advice. We need to tell them to drink more water. So, I have a lot of elderly patients. And it's very interesting. So, yes, I have heart failure patients, but, the majority of my patients don't have heart failure. And even if they do have heart failure, they still don't drink enough. So I think people have forgotten the importance of just actually drinking water. And, I tell my patients, you should be drinking, 8 cups of water a day or 2 liters a day. And, they look at me as if like I'm some kind of mad woman. So it's really important. You actually need to be drinking water because especially in the summer, how much you're losing, everything dilates and how dehydrated you are. And, people are playing golf, playing sports outside, then you need to have even more water. And then you also need to have some electrolytes as well, particularly those who are doing a lot of sport and sweating a lot. There are other ways you can also cool yourself down. And I think people think, okay, you just have to have air conditioning. But actually, there are some more effective ways and actually a bit cheaper and sustainable that you can do. So like self-dousing using like a spray bottle, having wet clothing on, using electric fans, the ice towels, so ice wrapped in a towel and applied to your neck or chest, wearing loose-fitting clothing, taking cool baths and showers. And I know, like, when I'm in Fiji, when it's really hot, I'm taking like three showers a day. Reduce, or just jumping into the water, reducing physical activity, avoiding hot environments, and avoiding working hours. Reducing your working hours if you're working in a hot environment. And again, this is another fact sheet. You can download this from Doctors for the Environment website about how to stay cool and stay hydrated. This is a really good paper. Professor Ollie Jay from Sydney, he wrote this a few years ago, but it actually gives the evidence about all these different available but also sustainable ways of actually keeping cool, not just air conditioning, because also air conditioning, if you think about how much energy it uses, and actually how much heat it also produces on the outside, these are much more sustainable ways of keeping cool. And less costly. And again, more information sheets. They're from the WHO about keeping cool for the general public during a heat wave. This is an app, and I'm sure I think you can use it. I'm not sure if you can use it overseas, but you can use it in Sydney, where you can actually plug in your location, and it will tell you your heat health forecast for the week. Like, is it going to be hot? How hot, what's your risk throughout this week? And so, for example, tomorrow there's a moderate heat risk, but it also gives you some recommendations about what to do. Like, for example, cool yourself, drink a glass of water every hour, even if you don't feel thirsty, whether you should use fans or not, how to keep your house cool, and then planning your day. So I think, and says, wear light clothing and things like that, and when it's going to be hotter. And you can actually personalize it according to, whether you're indoors or outdoors or what you're wearing as well. So I think things like that are going to become really useful for patients, but, also yourself, to kind of help deal with the heat and the heat waves. There are multiple medications that increase the risk of heat-related illness. Okay, this is like, it's kind of doubling up, but they're like two different lists, very exhaustive, okay? Think of all the A's. So you've got anticholinergics, antipsychotics, antihistamines, anti-Parkinson agents, antidepressants, anxiolytics, anti-adrenergics, antihypertensive, anti-epileptics. But they all have multiple mechanisms why they increase the risk of heat-related illness. And, obviously we're not going to remember all of them, but I think just being aware that some of these medications, when you're seeing these patients, do increase the risk of heat. And, I'll talk about this now, but trying to adjust some of them. So, but apart from just, you're not going to just suddenly stop them, because obviously that's, not the best health outcome. What you do need to do is make sure that they have access to cool places. You also need to make sure and remind patients that during heat waves, you need to keep the medications in a refrigerator. So, they need to be stored at less than 25 degrees. Using Panadol is only for people who actually have like a, they've got like a fever because they're unwell, so you don't use it just to reduce your heat, like your core temperature. And then think about other medications that have other side effects like diarrhea and vomiting. So that increases the risk of dehydration. There are multiple cardiac drugs, as I said, that change the body's mechanism in response to heat. And so antihypertensives is the one thing that I do modify quite a lot because I've got lots of patients on diuretics and other antihypertensives and nitrates. And so, but we don't just stop them. Okay. So I think what we need to do is kind of, talk to patients, let them, make sure that they measure it at home. They can kind of tailor it as well. So before the summer, I've said to some patients, if your blood pressure starts getting too low, maybe drop it down this much. And then you can kind of either drop or reduce, drop or actually stop some of them. And, particularly diuretics over the summer period. As well. But I think it's important that patients kind of are aware that the blood pressure gets lower during summer. They take control of the blood pressure, and then you can kind of change their blood pressure medications as well. So heat-related illnesses. This is another huge topic in itself, okay? We've got the most severe illness called heat stroke. And so, you know, this is really important because, you know, once you get to that level, this causes death. So I think being able to recognize that once you get those neurological symptoms, these people need to get to hospital straight away. And then there's other more moderate, so heat exhaustion, and you know what you can do with that. So mainly hydration, and then heat syncope and some more mild illnesses, but you know still important. So heat syncope, so feeling faint, you know, making sure they get fluids, but also lying down and cooling them before they get up again. Heat edema, heat cramps, and then heat rash. This is an algorithm for diagnosis and management of heat-related illness. This is a very good article in the New England Journal published a few years ago. And then how you respond, how you protect yourself from the health impacts of wildfire smoke. So patients need to be aware that actually you should not be breathing in wildfire smoke. They need to be staying indoors. You could talk to them about getting an air purifier inside their house. There's air filters in vehicles, using personal protection such as face masks. Probably need to have things like a proper N95 one to actually be able to get rid of, so try to avoid that PM 2.5 and those smaller particles. And then, you know, the other thing we'll talk about later, but it's more, you know, the greatest intervention for wildfires is actually prevention and the kind of recuperating forest health. So this is just a pictorial of how ways to reduce your risk of air pollution. This is just air pollution in general. So what I've talked about, wearing face masks, N95, air purifiers, avoiding exercising outdoors, reducing traffic-related exposures, using air purifiers in homes, making sure your windows and doors are quite well sealed so you don't get that outdoor air pollution coming in, using an air quality information app. So there's lots of good air quality apps available, keeping indoor plants. They also help purify the air, and eating healthy and drinking, avoiding alcohol and caffeine. The other thing we need to know is, like, if you are in a bushfire region, you should be prepared. You should have like a survival plan and an emergency kit. And I think this was quite interesting. So I was in Los Angeles recently and I visited my cousin, and she got evacuated from her Pasadena home. And she actually said that, you know, they were not prepared. They got a message from another relative and said, you know, I think you need to evacuate now. They opened their door and they could see the whole mountain, like kind of very close to them, all on fire, and all these cars coming past their house. And so they were like, we need to go now. So she said, we picked up everything with a living heartbeat. So them, their children, their dogs, they got their passports, and that was it. And they went to another relative's house, but they had nothing else. And then they were gradually like, oh my God, like, you know, we don't have this. You know, they didn't even have their contact lenses and all these other things you don't even think of. But like, you know, I think you need to be prepared, like if you are kind of in these bushfire areas, and also be aware of, you know, where to look for information. Like in here, it's like the ABC emergency websites, and also many of our state websites. And I won't go into this in the interest of time, but, you know, a lot of this has got to do, you know, with the health and reducing heat. There's also what you can do individually, but there's also the whole urban planning and what we can do, you know, in building cities and in our infrastructure. But that, you know, that is just another big area that needs to be addressed. This is just, again, a tale of two cities. And this is because, so in Sydney, we have Western Sydney and we've got Eastern Sydney. And we kind of show this, and this is, again, this shows us the importance of that kind of urban building and the urban heat island effect. But essentially in the west of Sydney, you know, it's like a lot of urban sprawl, that you don't get the coastal breeze, and you can get a 10-degree difference between like the east as well as the west. But, you know, things that also make a difference are, for example, shade. So this is, you can see the difference in temperature of the road surface, because one street, and these are parallel streets, sorry, one street has shade on it. But I think it's just an importance, like urban planning and all these things that we can do to make cities cooler are going to be actually very important. And lastly, I'm going to talk about something which I'm very passionate about. We talk a lot about climate change, and the whole health issues of climate change. But the biggest problem is that we need to mitigate climate change. And what people don't know is that there are multiple health co-benefits of climate change mitigation. And so I think if we can kind of, expand that, things that are good for the climate and good for the planet are actually also good for the health, we would be in a better space. So my biggest ones are plant-based diets, increasing active transport, changing to renewable energy sources, increasing green spaces, and healthcare sustainability. And as Belinda said earlier, we contribute significant greenhouse gas emissions from our healthcare. From a cardiovascular point of view, these same interventions can reduce cardiovascular disease as well as mitigate climate change and reduce greenhouse gas emissions. And there's a paper we published last year which did talk about cardiac co-benefits of climate change mitigation. We need to have climate action, and this is why I'm part of Doctors for the Environment Australia. I think all of us health professionals need to really call out to our governments and those other sectors that there are significant health effects of the climate crisis. So I'll end by saying we know climate change is causing increasing frequency of heat waves, but also has multiple other health effects. We're going to have increasing heat-related illness, heat-related deaths, and heat-related morbidity from many health conditions. The risk of heat-related illness is driven by heat exposure, but also individual factors and sociocultural factors. Wildfires have significant health effects, and the combination of heat and wildfires increases cardiovascular morbidity and mortality. Heat-related illness is preventable. Healthcare workers have a role in identifying patients at risk, providing counselling regarding signs and symptoms, and recommending strategies for reducing risk. And lastly, mitigation of climate change, as well as adaptation to an increasing hotter world, is imperative. Thank you.
So very, very much, Dr. Fu. That was just an incredible presentation. I feel a little bit overwhelmed with hearing all the information and everything that we kind of need to do as healthcare professionals. And but I think, you hit the nail on the head around, that whole climate change mitigation. We really need to go up the river and fix what's happening up the river first before trying to catch those that are actually coming down. So,
Sorry.
yeah, no, look, really appreciate your presentation. I guess from my perspective, a question that I would have is, are governments listening to, we have all of this research, but yet I think there are policies and that are still lacking in this space to support our communities.
Yeah, so yeah, don't like talking politics, but unfortunately we have to. So no. I think it is, and I think it is really important that we keep talking to politicians, because they have a lot of other vested interests. But I think that's why it's important that us as healthcare professionals talk to them, but also make public aware of the health implications, because I think ultimately governments are getting voted in by public, right? So I think if more people are aware of the health implications, then they can question their governments. So so in terms of what they're doing, so when the Labor government got in, the last election, one of the things from a healthcare sustainability point of view is that they set up a climate change and health sustainability unit. I don't know the full name of it, but so that was one of those things, and that was one of the things that we're trying to do, a bit like greener NHS, which is what they have in the NHS about trying to reduce healthcare's emissions. Okay, so that is something that has been established. What they're doing, not sure. We were involved in pilot studies in different hospitals to kind of reduce healthcare emissions, but it is going to be mandated in all hospitals going forward in Australia, a kind of like a healthcare sustainability like kind of module, or that has to be part of their accreditation. So that is something going forward, and that that is part of the government's kind of sponsorship. On the New South Wales level, there was a net zero hub, again, trying to get clinicians and other allied health, nurses, pharmacists, all these people in the Ministry of Health to try to reduce emissions. But, to put it lightly, from the healthcare sustainability point of view, which is another, big topic in itself, it takes an army. And that's what Nick Watts, who was the head of Greener NHS, said. It takes an army. It takes a whole lot of people on board just to make these changes. But I think the other thing I talk about when I talk about healthcare sustainability is that even if you make, like one little change, you can start talking to other people and then people keep making changes. So for example, I work in the cath lab and, there are a lot of people who want to do something, but they don't know what to do. So, we just started having the conversation, and then, out pops like, a proper recycling bin to put all like, all the paper, the cardboard recycling. I'm teaching them about clinical waste and what doesn't go into clinical waste and not. And, then people are more aware of it. And the more people you get talking and thinking about it, that has this flow on and ripple effect as well. So I think from your point of view, the nurses are the most important people. Well, sorry, I'm not sucking up, but like the nurses are, are so essential in this healthcare sustainability space because you're there most of the time, right? So if you want to talk about healthcare sustainability in every single hospital, everywhere you work, there is so much to do, and it has to come, to be honest, it has to come from you guys and the doctors. But that's where it's going to come from. Like you can't have these. Sometimes the admin people, they want to do something, but really, I think you have to have both the bottom up as well as the top down approach. So that's from the healthcare sustainability point of view. From the government, in terms of climate change and health, we've been trying to do a lot of that. Trying to call it out, but it's really hard. Like the whole problem is that fossil fuels have such a lot of power and money. And that is what we're up against. And so, but again, I think the more like forums like this, the more we talk about it, the more that people are aware, then people start asking questions, right? And people realize that, this is, like what these fossil fuel companies are doing is terrible. It's really terrible. Like so I think that's coming from the health angle. Even if you don't believe in climate change, I think coming from the health angle, knowing that all these effects of climate change, but also the effects of fossil fuels are really significant and, really terrifying. That I think that's what we need to use to change government. Okay. I think, I'm not going to get too political, but I will say one thing. I was in the US recently, as I said, and I am very afraid, right? Like in the US, my cousin is really afraid. She's in California, so they've just had, the worst wildfires in history. And, the head of the US does not believe in climate change and has taken themselves out of the Paris Climate Agreement, and they've also taken them out of the WHO, right? So, so it needs to come like, we all need to do something. I don't know how to say, like, it's just that it is actually really important that we are talking about this because it is such an urgent problem.
We appreciate your expertise and your passion as well. It's certainly, starting this project with my team from the Global Nurse Leadership Institute program, it's just, I'm very passionate about it too, and I'm finding my way and, starting my PhD in this space this year. So, which is really, really exciting. And, talking about it, having forums like this, maybe looking at it in our curriculums around, our healthcare professional curriculums, including climate health and planetary health into that. And as you said, the more we speak about it, the better. So thank you once again, but in the time, I know there might be some people that want to ask questions. If we do have questions, we can put it in the chat. We'll probably get to them if we have time towards the end, because we have another speaker that we would like to introduce as well. So thank you once again, Dr. Fu, and I'd now like to introduce Dr. Sunju Kang, one of our Global Nurse Leadership team members, to introduce our next keynote.
Thank you, Dr. Melinda. It is my pleasure to introduce Dr. Yeonsu Jang, a distinguished nurse scientist and educator. Dr. Jang is an associate professor and associate dean for research at Yonsei University College of Nursing. She holds a PhD in nursing from the Catholic University of America and both her master's and bachelor degree from Yonsei University. Her research focuses on improving self-management among patients with chronic illnesses, and she has led multiple funded studies to advance patient-centered care. In recent years, she has also played a leading role in advocating for the impact of climate change on nursing and healthcare. As co-chair of the Dr. Moin Kim Forum, named after the former ICM president, she has spearheaded initiatives to highlight nurses' critical role in climate resilience and health system adaptation. Today, Dr. Zhang will be presenting on advanced nursing for heat-related illnesses among vulnerable population in South Korea amid climate change. Please join me in welcoming Dr. Zhang.
Thank you for introducing me, Dr. Gang, and good afternoon. Thank you for inviting. Oh, sorry. Yeah. Good afternoon. Thank you for inviting me to this presentation. So my presentation is advanced nursing for the health-related illness among the vulnerable population in South Korea that amid the climate change. Dr. Fu also is talk about a lot of general information, so I'm more focused on the nursing law and the Korean example. So that is the content as follow. The global climate change. So we all keep saying about the global climate change right now. And then climate change is a long-term change in the average weather pattern that have come to define the Earth's local, the regional, and global climate. Climate change has caused the major and disrupt with the heat wave, flood, drought, and wildfires, and left it intensify the tropical current, disrupted the daily lives of millions, and caused billions of dollars in economic losses. So the Dr. Fu also mentioned that we remember that it's a big the massive wildfire and bushfire in the United States and Australia. That those kind of things that destroy the wilderness reserve and cause the many wildlife species to lose their habitat. And then global warming. Global warming is a phenomenon of climate change that is increasing severity around the world. The long-term heating of the Earth's surface observed since the pre-industrial period due to human activity in primary fossil fuel burning, which has increased the heat trapping greenhouse gases level in Earth's atmosphere. The human activities also are estimated to have increased Earth's global average temperature by about 1 degree Celsius. It is currently rising by more than 0.2 degrees Celsius per decade. That is going fast. And then this graph also showed the change of the average temperature in the world. So current global warming, the warming trend is proceeding in unexpected rate as a result of human activity since the 1950s. According to WMO report, and also Dr. Fu also mentioned in 2024 also, but 2023 was the warmest year on the record with the global average surface temperatures 1.45 degrees Celsius above the pre-industrial baseline. This global warming is caused a variety of social problems, including health issues. Korea also is no exception to this global climate change. So Korea is one of the largest emitters of greenhouse gases. Due to its industrial structures, centers of manufacturing, greenhouse gas emission from the energy use account for the large proportion. This graph shows that while China and the United States are overwhelming the greenhouse gas emitters, but Korea is also the 10th largest emitters in the world. Yeah, greenhouse gas emissions are driven up to the temperature in Korea as well. So Korea has a distinct four-season climate. And so in general, the summer in Korea is humid and hot, and winter is dry and cold. However, average temperature in South Korea has steadily increased over the years. The average temperature was 14.9 degrees Celsius in 2024. That is, extreme weather events are often the tropical night and typhoon and heat wave in summer and severe cold in the winter. The summer climate, which is usually lasts from the June to August, but it's getting longer than can last from the May through the September. In this graph, we can see that the average temperature has been steadily increasing since 1973 with a sharp increase in 2024. This graph also shows the number of tropical nights in Korea over the past decade. And unfortunately, in 2024, Seoul was very, very hot. So Seoul broke the record for 118 consecutive years of a tropical night. So after brief decline during COVID-19 pandemic, there was an increase, but there was an increase in 2022 and steep rise in 2024, which is thought to be related to the return to economic activities. And then climate change is, we also, Dr. Ford talk about the relationship between climate change and health. And then climate change treated our health. So one report predict that climate change will be the third leading cause of human deaths by 2099. So, and also climate change triggers developed of a variety of disease, and there are heat-related illness. There are direct caused by rising temperature. So these are illnesses is also Dr. Fu mentioned about that. So there's his stroke and heat exhaustion and rhabdomyolysis, and then heat syncope, and then crabs. So I don't want to talk about those kind of things that we already talk about that. So heat related. So I more talk about the relationship, the problem that has related to illness in the vulnerable population. So I think that we, Dr. Fu also the same, we looked at the same, research, the result. So according to the research that they mentioned the vulnerable populations. So heat-related illness is known to be the higher risk in vulnerable population, and recent research suggests that risk of a heat-related illness influences not only the individual factors but also the social cultural factors. So they that the result is mentioned that vulnerable population is older person, young children, and pregnant women, until the person living in the lower income household. In Korea also, there is also concern about the managing heat-related the illnesses of vulnerable population. So a study targeted Korean, the report that heat-related illness were more prevalent in elderly population who presented to emergency department. There another study in Korean, among the Koreans also reported that people with disabilities were more vulnerable to heat-related illnesses. These findings suggest that we need for the customized preference the strategy that taking into the account the characteristic of vulnerable populations. based on this diverse evidence, Korea having the health-related policy direction for the vulnerable population facing climate change impact. So we also the talk about the health policy. It is very important to change the many things. So first, we identify and define the vulnerable group. So that is, we think about who are vulnerable in climate change. So the group vulnerable to climate-related health risk have a lower adaptive capacity and are at risk of increased exposure to extreme weather events. So these vulnerable groups are identified as elderly, infant children, and pregnant women, people with a chronic condition, people with a disability, so low income, homeless, outdoor workers, and residents of substandard the housing. So among this population group, there's no athletics in Korean policy. And then second is a targeted financing assistance. This is about the energy voucher and the energy efficiency grant for the low-income household. And then third is improving public health infrastructure. So like we're gonna build the clean water and sanitation, the other essential health care system is like a health infra is very important. So you already know those kind of things. So first is the local government initiative. So, but based on vulnerability assessment, it goes beyond the reactive measures such as setting up the temporary cooling center to increase proactive, community-led, and the local tailored interventions. In addition, so we also think about the data. Data is very important. So data driven the policy making and developed a legal framework. So based on the government policy, I would like to introduce some examples on how Korea is implementing healthcare for vulnerable groups during heat wave. The first one is example is the home health care service. So since 2007, public health centers in Korea have been providing home health care services to local residents with high health risk factors. So, but it has a healthcare team. The service is comprised of a variety of healthcare providers, such as nurses, physiotherapists, occupational therapists, and exercise specialists. They work together to provide multidisciplinary care. So there also the population is the vulnerable population when we did. So these pictures they are working with for vulnerable population. And second one is another example is a public awareness the campaign. So we talk about those kind of public campaigns, but we develop based on patient the people their education level. We developed several kind of leaflet and poster, and then we do public awareness. We try to increase the public awareness regarding heat the management. And in addition, as it show the picture on the right, we have the installed awning at the railroad and crossing to provide the shade and help people stay cool while they wait for the work signal. So we have a cooling center also like those kind of the shade. So this shade is very popular for people. It is very help to protect the heat during the very hot days. So we also distribute the cooling supplies such as ice pack and fan and cooling vest and provide the support and the health care and the living space. However, there are the challenges and limitation as managing heat related illness in terms of a policy. So first thing is a data gap. So our policy, the data-driven policy is very important, but there is still data gap. The comprehensive data on the heat-related illnesses and mortality with a specific vulnerable group is often lacking, hampering the accurate assessment and efficient resources allocations. The second is the fragmentation of effort. The responsibility for the heat wave preference often falls across the multiple government agency and the local level. The result in inconsistency in program implementation and coverage. And then next issues is accessibility issues. Even the Korea is not big country, but still we have some accessibility issues. So accessibility of a cooling center and other service might be limited due to geographical location and physical limitation or language barrier as well. The last, the resource allocation, the funding and resources dedicated to protecting vulnerable populations are not always equitable across the region and community. So we try to figure out that these are challenges and limitations and then try to solve the problem. So what should we nurses do in health issues regarding climate change? It's time to think about what the role the nurses in challenging and changing the climate, especially in the context of global warming. So in 2019, ICN published the position statement on the nurses' role in climate change and health. So according to ICN statement, nurses' role are mitigation, adaptation, and advocacy, education, and disaster response. So first thing is mitigation. So mitigation is also, we mentioned the previous presentation. So mitigating greenhouse gas emission in healthcare through the adoption of a sustainable practice is an action that minimizes unnecessary travel, promotes the environmental responsible policy in healthcare sector. The conference that what we are doing today is another way of mitigating. The second is adaptation. That these includes building climate resilience health system, developing climate informed health programs, and strengthen the response of the capacity of a health of our workforce. And then third is the advocacy. Advocacy is engaging in health and climate research and participating in policy and governments and the rising public awareness of a harmful effect of climate change on health. So next is education. It is important to integrate the climate change knowledge into the nursing curricula and continuing education program. In most nursing education, some postgraduate program teaches about the climate change regarding health issues regarding climate change, but it is not a common curriculum. This situation is also same in Korea. So we are just started and then pay attention for the climate change, the relationship climate change and health, but it's just the beginning stage. So it is necessary to learn the climate change related health in nursing education. The last is a disaster the response. It is working with a humanitarian organization to address health issues caused by climate change related disasters. So, what are the nurses' strategy for addressing the climate change, addressing the climatic crisis. I'd like to talk about the strategic level, the personal, organizational, and national perspective. The first personal perspective, the level. The first is the implementing sustainable practice. So we can reduce our carbon footprint by conserving energy, using public transportation, and adopt a planning-based diet on your daily life. And then second is participating in research focused on health issues related to climate change and collect data. And another thing is health education. Educating about the health impact of climate change and method to mitigate these effects can increase community awareness. And the next is organizational perspective. And we can make the hospital more eco-friendly by using better energy saving practice and improving recycling and waste management. In addition, in collaborating with the healthcare team, we are working together with other healthcare professionals to engage in research, develop the program, and create the policies that tackle the health impact of climate change. And the last is advocating for policy change within the organization. So we are here to support, promote the policies that focus on sustainability and public health in response to climate change. In national the level, so we are advocating for the legislative change in the national level that address climate change and health issues and highlighting the importance of this topic in health policy. We need to participate in this national campaign to raise awareness about that has impact to climate change and enhance understanding across the community. And also, we can participate in the research program funded by the National Health Organization to contribute to the better understanding of the health impact of climate change and the population level. Climate change can pose the threat to human health, but I believe that we can overcome this crisis as a nurse. Addressing climate change issues require the cooperating that goes beyond the individual and organizations to national and international level. So Florence Nightingale said that nursing is to put the patient the best condition for the nature to act upon him. So as a nurse, we must pay greater attention to climate issues and contribute to creating the healthier planet. Okay, thank you for the attention. Thank you.
Oh, okay. Thank you for your excellent presentation through the Dr. Moin Kim Forum in Korea. We have been exploring how nurses can better prepare and contribute to health policy in the context of climate change. So beyond the Korea, I'm just hear your opinion. Beyond Korea, from a WEPRO perspective, what key areas do you think nurse should be more deeply engaged into strengthen its role in preparedness and policy making?
I think that we have the make a big voice is a very important thing. So I think that as like the other health policy, it's a more powerful thing. So we need more evidence to the relationship between the health issues and climate change. So we need to do more. I think that this the time is a very good chance to get work together to gathering the evidence such as we are doing the research thing, and then we need to present it the evidence, and then it can make more easier way to establish a health policy regarding these issues.
Thank you.
On our attendees online, if you want to put your hand up and I can unmute you for any questions, or you can put it in the chat as well. Thank you so much, Dr. Jang, for your presentation. Once again, it certainly brings a lot of things in terms of what we've got to do. And that research, yes, definitely we've got to do more research so that we can influence policy. So thank you, appreciate that. I'd now like to hand over to Dr. Yeo May to have the closing comments. Thank you.
Okay. Good afternoon, everyone. Maybe in Australia it's already evening, right? Okay, thank you for being here, all of you today, and actively participating in this crucial discussion on enhancing heat safety for a vulnerable population in the Western Pacific region. We've had the privilege of hearing from two distinguished speakers whose insights have shed light on challenges that we facing and the strategies we can employ. Dr. Fiona Fu highlighted the direct impact of heat on cardiovascular health and mental health, particularly among vulnerable populations. Her presentation underscored the urgent needs and for targeting interventions to protect those most at risk, including the elderly, individuals with pre-existing cardiovascular conditions, young children, outdoor workers, or athletes even, and socio-economically disadvantaged groups. So the intersect of climate change and cardiovascular disease is a growing concern as well as the wildfires or bushfires. And so I think Dr. Fu's emphasis on the preventive measures and public health initiatives is a call to action for all of us. We also learn to teach patients about medication adjustments, which is really important as the nursing role. Dr. Yongsu Zhang, thank you for providing an equally compelling perspective from nursing field. She illustrated advanced nursing strategies for managing heat-related illnesses, particularly in South Korea's evolving climate landscape. Integrating climate resilience into nursing practice is vital, and Dr. Zhang's work exemplifies how healthcare providers can adapt and lead in the face of climate changes. Although although challenges and limitations exist, nurses' role in data collection and policy advocacy on climate change and healthcare issues is apparent. So as we reflect on these insights, it is clear that multidisciplinary collaboration is a key. Protecting vulnerable population from heat-related health risks requires the combined efforts of healthcare professionals, policymakers, community leaders, and researchers. So let's continue to share knowledge, advocate for climate resilience, and implement effective strategies in our respective fields. Together, we can build a safer and healthier future for all. Thank you once again to our keynote speakers, participants and organizers, we are deeply sorry that one of our team member, Dr. Sharifa Mohidem from Malaysia, is absent because of a family emergency this morning. I hope it's not due to the climate change, overheated cardiovascular issues. But on behalf of our team, I want to thank ICN for funding support, and also Dr. Kathleen Schofield, who is online today with us. I want to thank her mentorship for the GNLI journey. Because of her company that make us to this now. I encourage everyone to stay engaged and collaborate and take action on the climate change and health issues. So stay safe. Let's continue the conversation beyond this webinar. Thank you so much. Hand it over to Belinda.
Thank you, Yun Mei. Appreciate your closing statements. And once again, thank you everyone that came in attendance today. Thank you so much to our esteemed keynotes, Dr. Fiona Fu and Dr. Yunsu Zhang. I think you really enlightened everyone that's been on this webinar. We did have 105 registrations and we have been live streaming this through YouTube as well. So we'll get to a broader mass and we've had about 26 attendees coming into this webinar today. So in conclusion, thank you all once again. Keep safe and let's keep talking about climate health and climate change and let's make a difference. So thank you.
Thank you so much. Bye.
Thank you. Bye.
Thank
Bye.
you. Bye.
Thank you so much.
Thank you. Thank you.
Thank you.